Hello, my name is Lucy Bologna and I am the spokesperson for the Cancer Association of South Africa. Today we are actually having a special discussion as part of the Global Week for Action on Non-Communicable Diseases, or NCDs as it's known, and this takes place from the 18th to the 20th of September each year. This year we are focusing on the role of leadership in driving the fight against NCDs in Africa and South Africa. Non-communicable diseases such as cardiovascular diseases, strokes, cancer, diabetes, and chronic respiratory conditions remain among the leading causes of death and disability globally. And in Africa and South Africa, this burden is growing rapidly. Today, I'm joined by three leading organizations at the forefront of this fight: the Heart and Stroke Foundation South Africa, Diabetes South Africa, and the Cancer Association of South Africa. Also joining us today is Dr. Bisiswiswe Ndlovu. She is the Director for Non-Communicable Diseases at the National Department of Health. We're so glad that she could join us because it's so important to have the Department of Health contributing and part of this discussion. Together, we want to explore how leadership at organizational, community, and policy levels can make a difference in tackling NCDs across our continent. I'm going to start off with Dr. Ndlovu on our side. I just want to give you some background on her. Dr. Ndlovu is the Director for Non-Communicable Diseases at South Africa's National Department of Health, where she is responsible for NCDs, disability and rehabilitation, geriatrics, palliative care, as well as eye, ear, and hearing health. She oversees the development and implementation of key national strategies, including the National Strategic Plan for the Prevention and Control of NCDs, the National Cancer Strategic Framework, and the National Policy Framework on Palliative Care. With 35 years of experience in primary and occupational health, she has served across government, academia, non-governmental organizations, and I'm going to start that sentence again. With 35 years of experience in primary and occupational health, she has served across government, academia, non-governmental organization, and humanitarian organizations with a career dedicated to advancing integrated care for both communicable and non-communicable diseases. Her leadership continues to shape South Africa's health response, particularly in strengthening equity and access to NCD prevention and treatment. Dr. Ndlovu, we are so honored to have you join us. And I'd like to start by asking this question when it comes to policies and priorities. How would you say the Department of Health is ensuring that non-communicable diseases remain a priority on South Africa's health agenda? I know we've got other pressing challenges of infectious diseases like HIV and TB. I think we particularly want to focus on the non-communicable diseases.
Thank you very much, and good afternoon, colleagues. Thank you for having the Department of Health at national level on this meeting. In answering your question, as you may know, that non-communicable diseases have taken over from the communicable diseases. They are a number one priority. And with the burden of diseases that we are seeing from patients who are suffering from, I would say, diabetes, hypertension, that is like a leading burden of disease in our country. So as National Department of Health, how we ensure that it stays on top is that we are making sure that with the NSP, or the National Strategic Plan on Non-Communicable Diseases, that is still in place from 2022 to 2027, we ensure that the priorities that are on that NSP are moved forward, and we make sure that at our facility level, we drive those priorities so that our patients are taken care of and they get the necessary support. If I may just indicate that the priorities that are on this NSP on NCDs is the cancer, it's the diabetes, the hypertension, chronic obstructive pulmonary diseases, your mental health. All these are sitting under NCDs, but We've also added obesity, much as it's a risk, but we've added it as a disease, because we are picking up that from a very young age, if a child is obese, that child is at risk of ending up with the type 2 diabetes, let alone those children who have got type 1 diabetes, which is mostly genetic. So in looking at these priorities, we've got a model that says 5 by 5. So with the 5 priorities, they are aligned with 5 risk factors, which is the tobacco, smoking, the use of alcohol and substance abuse, people who are inactive, wrong diets. If I say wrong diets, unnutritious diets, and then the risk of obesity as well. So for our office here, which is responsible for NCDs, besides that we develop, we review, we evaluate policies, we make sure that we monitor the implementation of these policies at all provinces and district level. We even conduct audits, clinical audits, just to ensure that what we are saying on the policy framework, it is what is happening at a facility level. Where there are issues, then we sit down with the teams at a facility level to come up with quality improvement plans, so that we ensure that whatever that is being given to our patients at the community level, it's exactly what is sitting on the policy. And as it is now, there are some policies, because questions might come up, the policy framework that are still under review, like the CANSA framework, the one on disability and rehabilitation, the palliative care, because those are all the responsibilities that are sitting under the NCD Directorate. So we are in the process of evaluating some of these policies, and also ensuring that they get reviewed and they will be passed at the National Health Council. So I'll end up there for now, and then find out if there's more or any follow-up questions from that. Thank you very much.
Thank you. I'm so glad that you mentioned the mental health aspect. Often that is very much a side effect or an implication for many of these NCDs, how it impacts. I mean, so many South Africans are living with an NCD, and it's got this added impact of how it affects you in your personal, your family, and your work life. And it's very much a role that many civil society and organizations can play to assist people living with NCDs. I was also glad to hear that you mentioned about the lifestyle messages. It's very similar to what we all as organizations, it's a similar message, all of us, eating right, the right foods, drinking right, making sure you maintain a good weight, because obesity and all those things are linked to cancers and other heart diseases and diabetes. We have just one more question we'd like to ask you. How do you think that government can strengthen collaboration with civil society organizations like ourselves, the Cancer Association, the Heart and Stroke Foundation, and Diabetes SA? How could we accelerate progress in prevention, treatment, and patient support?
Look, we cannot, handle this fight alone as the department. We need all the hands on deck. So for us, we need to collaborate all our activities, be it with academias, with researchers, with civil society organization. We need to talk in one voice. So what we are busy with now as the department, we are moving towards collaborating or formulating a multi-sectoral structure, which shouldn't be like one for cancer, one for heart foundation, one for diabetes. We need to bring everybody into one table so that they understand that we are looking at a patient-centered approach, because this one patient can be having a stroke, a diabetes, or whatever. So We are in that process of formulating or developing multi-sectoral forums. From a provincial level, then we have the largest one, which will be a national multi-sectoral forum, bringing all the stakeholders together from different walks of life, so that we are able to sit in one table. Because at the moment, the structures are very fragmented, and you can imagine I'm the person responsible for all the NCDs, and I get calls from CANSA, I get Cancer Association, I get calls from Heart and Stroke Foundation, I get calls from everywhere. So this multi-sectoral forum will help all of us, not just me being in the directorate, but also for all the other organizations to also learn from each other. How do we support each other in supporting the communities out there which have got this burden of disease? Thank you.
Thank you, Dr. Ndlovu. That is so important, and hence why we are doing this special discussion and working together as civil society. We have 3 organizations that are now collaborating, and we so believe in collaborating with the Department of Health because we cannot do it alone. The burden and the challenge in South Africa is too high, and also in Africa. We appreciate that you joined us. We appreciate your inputs and your insights, and we look forward to collaborating together in the future. Thank you.
Thank you very much for having me.
And now we're going to be focusing on the Heart and Stroke Foundation in South Africa. We have Professor Pamela Naidoo. She is the Chief Executive Officer of the Heart and Stroke Foundation South Africa. She is a clinical psychologist with a master's degree in clinical psychology and public health and a doctorate in behavioral medicine. With over 35 years' experience in the health sector, Professor Naidoo has focused her career on the intersection of NCDs, mental health, and infectious diseases. She is a National Research Foundation rated researcher, an extraordinary professor at both the University of the Western Cape and Stellenbosch University, and has published extensively in public health and behavioral medicine. Internationally, she has served in leadership roles, including past president of the African Heart Network and member of expert committees of the World Heart Federation and the World Stroke Organization. Professor Naidoo, welcome and thanks for joining our discussion.
It's an absolute pleasure. Wonderful. Thanks for the kind introduction.
Great to have partners on board when it comes to tackling NCDs. And I'm going to start with this question, sort of focusing on leadership and strategy. How would you see the role of leadership in shaping the national and regional responses to NCDs in South Africa?
Yes, that's a wonderful question. So I do believe that when you're in a leadership role, you have to be sober-minded about how you go about advocating for change. And I think that once you have the kind of experience as a leader, you will obviously use the science-based approach because you work on data, you work on knowing what actually works versus what you're being convinced and told that despite the science that governments or the powers that be do not want to uptake those policies. And so I think the thing about leadership is being able to navigate, but also to fight the good fight and to never let up on fighting the good fight.
I think it's important that organizations such as ourselves are consistent and show up and get involved in educating about the NCDs, and especially when it comes to heart and stroke and cardiovascular diseases. What are the current stats in South Africa of how many people are being diagnosed with these diseases?
Yes, so, what we call the epidemiological pattern in public health is really important because it informs the greater knowledge around that particular issue. So if you take heart disease and strokes, collectively known as cardiovascular conditions, in South Africa, it is the leading cause of non-communicable disease deaths. So, about 225 people die every day from one of these conditions. Now, if you take together with infectious diseases like HIV, AIDS, and COVID in the past and so on, almost 50%, so close to 48% of the deaths are really due to non-communicable diseases. And within the non-communicable diseases cluster, unfortunately, heart disease and strokes does have the highest prevalence and incidence, as we say in public health. So, it basically has the highest numbers. Now, interestingly, diabetes, while it's also one of those key non-communicable diseases, it's also a driver for heart disease and strokes. And then more recently, we're also seeing the comorbidities. So, one has to look at this. It's very complex. So just crunching the numbers on heart disease and strokes does not give you the full picture, because you'll have one person having, as our good doctor said earlier, you can have cancer, you can be HIV positive, and you can have a cardiac condition. So it does get quite complex.
Absolutely. And I think when she spoke about the health messages, we all seem to have very similar health messages, which are consistent across the board. It's the same thing it's the lifestyle of how we can educate as many South Africans as possible. And it's quite a challenging role, because it's resources. As many times as nonprofits, we really struggle to get the resources and the buy-in, and we need that public-private partnership and that collaboration with the departments of health, or else we cannot achieve what we are to do. And that leads me on to the next question. Can you share examples of how your organization has demonstrated leadership in advocacy, awareness, or service delivery?
Yes, I love that question. And the reason I love that question is because, oftentimes when you're working globally, it's all about the policy and driving, health policies and fiscal policies like this tobacco sin tax and so on. Absolutely critical. But I do think that in leadership of a nonprofit, a health nonprofit, the difference we can make is no matter, yes, we should have a pillar that works on advocacy and policy, but largely what needs to be visible in the public space is the actual implementation of the programs we run. So it's good to showcase what we're actually preaching. So if we're saying, for example, for non-communicable diseases, which includes cancer, heart disease, and stroke, and so on, the top 5 risk factors would be hypertension, alcohol, excessive alcohol consumption, tobacco smoking, raised cholesterol. There's common risk factors. But what we need to do is the programs we run, the campaigns we implement and roll out need to have a practical component that shows people that is to you. So one of the things I'm opposed to is using the term lifestyle. So I think in leadership, one has to also unpack concepts that have been utilized and, in my mind, ineffective. And I really do believe if you call it what it is, and what it is adopting healthy behaviors, because lifestyle is just too broad and general, and it actually has a positive spin. So it couches, it blocks what it actually is meant to convey. So I think really around people being self-aware, but also gaining the knowledge of what are the risk factors. Some of it is genetic, that's true, and we need to know our genetics, but we also need to be aware of, well, what are our behaviors that's lending itself to the onset of cardiovascular disease or other non-communicable disease conditions.
So that's interesting. You call it, what was the term that you used?
I would say the behavioral, to be kind of very fancy, you can say the behavioral repertoire. But what you're really looking at is the healthy behaviors and not so healthy behaviors, And the irony of it all is that people often know, but they do not do. And so the key in my mind for nonprofits is to actually bridge that gap. How do we get people to adopt those actual behaviors?
Absolutely. So you always look at certain brands that would reinforce or reward positive, healthy behavior versus the other way around. I quite like that. It's also, we advocate for physical movement. We often talk about physical movement and not exercise. It's a kind of a nice positive way of saying just moving, and even if it's a walk, it's still doing something that can lower your risk for all of these NCDs, as seeing it as in a negative light. It might not, it sounds better than a chore, something you have to do. Quite like that. I have one more question. I'd love to know, from the heart and stroke, if someone has a patient, a survivor point of view, what role do you think they can play themselves in tackling NCDs?
The patient, I think patient engagement is a very core component of the work we do. So the way in which we're not membership driven as a foundation per se, but, we do serve many communities around the country, and we have a core group of champions and advocates that's, drive our messaging, but through their own experiential account of having cardiovascular disease. And I think it is absolutely critical because, it's probably not such a good thing to be preaching if you've not experienced it. Whereas, if you're in the background and you put the central figure as the person who's actually got the experiential account, I think it's a much more powerful way to convey any form of health messaging.
I can so agree with you. Having the person share their personal experience, a story of what that's like and how it's impacted them physically, emotionally, spiritually, how it impacts them in their work, their life is very important. And it makes it real and authentic. So we also advocate that people share their personal stories because it also serves to inspire others who may be living with a similar diagnosis and how they can actually work together to tackle NCDs.
In closing, I think that this interview that I've had with my colleagues is just so fitting, given that the UN high-level meeting is around the corner on the 25th of September. So I would urge everybody to join forces and to ensure that despite a little setback with the draft of what we want to propose for NCDs, we really need to be a stronger group, a stronger consortium, because the industry, be it the health or food industries, the tobacco industries, and so on, that are not in the best interest of the people we serve. I do think we owe it to ourselves and we owe it to our organizations and our country and globally that we stand together and really push on at the NCD's UN high-level meeting in September.
Our final organization that we're going to be looking at is the CANSA Association. And we have Zodwa Sithole, who's the head of advocacy. He has more than 30 years of experience across nursing, community health, and palliative care. She played a key role in shaping the country's national palliative care policy and has pioneered initiatives integrating palliative care into correctional facilities and community health systems. Zodwa also has been active globally, serving on the International Children's Palliative Care Network Board and the Roche Lung Global Patient Council. She has been a driving force in cancer advocacy and health equity in South Africa. She remains a passionate advocate for ensuring that people living with cancer and other life-limiting conditions receive passionate and equitable care. We're honored that you can join us, Zodwa, and share your views when it comes to NCDs. And I'd like to ask, how do you see the role of leadership in shaping the national and regional response to NCDs in South Africa?
Good afternoon, Lucy, and thank you for inviting me to join this team. Lucy, I would like to say, to fight the battle of NCD, we need each other. We cannot fight this battle alone. And CANSA is so proud to stand in solidarity with global and local partners to advance impactful prevention, early detection, and early access to treatment.
Thank you, Zodwa. I think it's important. Again, it seems to be this constant common theme that we all have as civil society, that we cannot fight the NCD battle alone. And it's so important in South Africa that we are combining, working together. We then move to Africa, and then we are going to be making the presentation at the UN Council. And again, it seems to be that collaboration is the key word of how leadership can emerge in the fight against NCDs. I want to just ask you, can you share of how much CANSA has demonstrated leadership when it comes to advocacy, awareness, and service delivery?
No, thanks, Lucy, for that question. Let me start with advocacy. You know how we have demonstrated leadership in supporting patients. You know, we as CANSA, we are being contacted by the patients and their families, frustrated regarding the poor access to cancer treatment. Things like long waiting periods before they start the treatment, waiting for the results. It might be biopsy or any result. So we as CANSA, we are taking leadership in supporting the patient. We contact the hospitals to say, this patient is waiting for the results. This patient was seen in February, now it's July, and he hasn't got the treatment. The date for the treatment. And I must say, it is working. And that's why I'm saying it's so important that we have the National Department of Health here. So it is working, and it is important for CANSA to work together with national and provincial Department of Health. That's how we take leadership when it comes to advocacy.
Thanks, Zodwa. And when you talk about the challenges of patients, I know in South Africa, some groups are at a higher risk of cancer than others due to their comorbidities or because of unequal access to treatment. So advocacy plays a huge role. But when it comes to leadership, when it comes to awareness, what would you contribute? How does the CANSA contribute?
You know, Lucy, I need to mention that our health program as CANSA is comprised of health education campaigns around awareness of cancer symptoms, the importance of screening, and the importance of lowering cancer risk, like living a healthy life, doing physical exercise. And, for us, that's how we take the leadership as a Cancer Association of South Africa when it comes to awareness.
And education is so important. And I know as CANSA, we actually try to translate our materials, our educational materials, into most languages because that is so important. And Zodwa, tell us about your collaboration with the provincial departments of health.
Lucy, as I mentioned earlier on, we cannot fight this battle alone. We need each other. We need to work with the national and provincial Department of Health. I'm so proud and excited to mention that we as Cancer Association of South Africa, we have formally signed the MOU with some of the provincial Department of Health. And it's so nice that where we are now, we are implementation what we have agreed, how in terms of our partnership. And we are so excited about this partnership. And I can see, Lucy, that one of the things which I'm very excited, which I want to mention, we as CANSA, what we are busy doing now, we are training the primary health care nurses on top 5 cancers with the aim of early diagnosis, early access to cancer treatment. So it is because primary health care is the first entry of our health system in our country. And what we are doing, Lucy, at the moment, we are training the outreach team leaders on the top 5 cancers. And the outreach team leaders are at the community level, working with the community healthcare workers and the traditional health practitioners. We are really hoping and negotiating with the department that once we have trained the outreach team leaders, they will train the community healthcare workers on top 5 cancers so that when they visit the community, the patient, if they present with a cancer symptom, they can be referred early. And also, we are so excited that, because we have trained the traditional health practitioners, but it was just a handful. So if we train the outreach team leaders, they'll be able to train the traditional health practitioners at the community level. So that's what we are doing with the Department of Health. And Lucy, some of the provinces, they've already included CANSA in their community healthcare workers screening tool.
That's fantastic news. And to hear about the wonderful work that CANSA is doing with traditional health practitioners is important, because we are helping to educate and to lower that cancer risk. And I think there's also a lot of screening and early detection. Screening and early detection can play a huge role when it comes to tackling NCD. We can lead organized screening efforts targeting high-risk populations, screening for breast, cervical, and other cancers. And all of this can contribute to early diagnosis and improve treatment outcomes.
And Lucy, sorry to disturb you. I can share a story. One day I was called by the traditional health practitioner. She said, "Zot, I'm in my consulting room. I'm suspecting that this patient might have cancer. What must I do?" So I advise her what to do. But can I tell you, she later told me that, yes, that patient has been diagnosed with cancer. So it is important to work with them.
We're potentially saving lives. Absolutely. And now we're moving on to Diabetes SA, which is another important organization in South Africa. And representing Diabetes SA is Margot Makamsky, who is the national manager. She has dedicated many years to improving the lives of people living with diabetes through education, advocacy, and support programs. She joined Diabetes SA 35 years ago when her husband was diagnosed with type 1. Under her leadership, Diabetes SA has expanded its role in raising awareness, building patient support networks, and advocating for improved access to care. Margot is particularly committed to empowering individuals with diabetes to manage their health effectively, while also addressing the growing burden of diabetes in communities across South Africa. Margot, thank you for joining us today. And I'm going to go straight into the theme of the Global NCD Week of Leadership. And how do you see the role of leadership in shaping the national and regional response to NCDs in South Africa?
I've been with the organization 35 years, but the organization has been in existence for 56 years. And in 2006, when we had the World Congress in Cape Town, 14,000 delegates from around the world came together to address diabetes and the impact that it was having worldwide. So in 2006, I met Elise and Pamela from Heart and Stroke and CANSA, and we got together and decided that possibly by joining hands, we would have more of a voice, a louder voice, and more of an impact. Because a lot of these issues, cancer and heart and stroke, people with diabetes also have, especially the cardiovascular issues. It's one of the main complications of diabetes. So together, knocking on the Department of Health's door and making a louder noise, and in turn also reaching out to the International Non-Communicable Disease Alliance, and also being invited to the UN NCD global focus, hoping to get more attention drawn to these three very important diseases which are killing so many of our people. I was recently at the Global Diabetes meeting in Thailand, and according to their latest stats, we have 589 million people worldwide living with diabetes. But that's an underestimation because they underestimated South African stats by 2 million. So you can imagine that it is far more than that. Now, those people are all at risk of very serious life-threatening complications. We need to have diabetes, heart and stroke, and cancer as one of the main focuses in the health scenario, because if we don't turn the focus, then we are going to lose more and more people are being diagnosed. They say that for every one person that dies of diabetes, 2 people are diagnosed. So, it's almost like we're fighting a losing battle unless we step up and join hands, and unless we get sponsorship from entities worldwide, funding entities, in order to get our messages out more, help people to manage diabetes. So many people do not get the education and the information that is needed to control their blood sugars. You think about something in your body that an organ which is not working, and you have to manage it manually by doing tests, by doing injections, by taking medication, there's 30 different things or more that manage to push your blood sugars up or down. And a lot of those things are very difficult to control. So people need the tools and the education, and this is something that they are not getting. There is not enough information out there. People misunderstand diabetes. They talk about, you must have given your child too many sweets because, they've got type 1 diabetes. People do not understand the difference between the different types of diabetes, that one is an autoimmune disease, the other one is high risk for genetics, because people possibly in your family, even 2 generations ago, could possibly have had diabetes and you wouldn't know it, but you are at risk. So there needs to be policies in place to address these issues and help people, give them the tools and the information they need in order to live well. It is possible to live well, but you need help, you need education, you need support.
Thank you. So, Margot, definitely when you spoke about collaboration and the importance of working together, it's hence the reason why we as 3 organizations come together to raise awareness of NCDs, because often they have the same health messages. And we were pleased that Dr. Ndlovu did join us for our discussion. And I think there are many challenges in the health system. And I think it's important. Collaboration is the start of getting that education. Collaboration and getting sponsorship is the start of getting more South Africans educated. But can you share examples, particularly of how Diabetes SA has demonstrated leadership, or the activities that they do when it comes to advocacy, awareness, or service in the community?
Well, as I said, Diabetes SA is 56 years old this year. Right from the beginning, we've been focusing not just, but on children with diabetes, because type 1 diabetes is an autoimmune disease. In other words, your immune system destroys the insulin-producing cells in your body. And previous to the 1920s, when insulin was discovered, children used to die if they developed type 1 diabetes. So now there are tools, but sometimes it's out of reach for the average person, because a lot of these tools are expensive. So we've been doing camps for almost 50 years for children with diabetes, where we take them to a camp. We have lots and lots of fun. And we address different challenges and issues that they might have, and help them on their journey with diabetes. And children always say, we're definitely coming back again. They are thrilled to meet other children with diabetes and to interact with them, because they can all speak the same diabetes language. We also reach out to parents with children with diabetes, because it can be really heartbreaking to have a child with diabetes. And to use an example, one man came to my office and he asked me if we had any information for children, and I was starting to show him and he burst into tears. And I said, what's going on with you? Why are you so upset? What can I do to help? And he said his 2-year-old child had been diagnosed, and children are used to being cuddled and loved, and now they have to hold this child down to do the insulin injections and the blood glucose testing, and she is fighting and kicking and scratching and biting because her parents are hurting her. So you can't explain to a 2-year-old why you're having to do this. So parents also need the support and the help to travel this journey with a child. So we also focus on groups. So we started years and years ago developing, we call them diabetes community wellness groups. And at the moment we have about 40 around South Africa. And these groups are run by volunteers who reach out into their community and invite people with diabetes to talk about it. And we support them, give them literature and help and guidelines. And some of these groups have been going for 25, 30 years. And that's because our model has been very successful. And we're growing the groups constantly, year by year. So we do a lot of screening out in malls, in communities, in companies. Last year, I think we did about 4,000 screenings. And this is to catch people whose blood sugars are not normal, and also those who are struggling to control, to give them support and information to help them, and to tell them to contact us when they are struggling. Because we give help by telephone, by email, by referring people to those that can help them with their particular issue. We have a magazine called Diabetes Focus that has been going for 25 years. It was initially in print, and now year 2014 we put it online, so it's free to anybody. And we update those articles every 3 months, 20 to 25 articles every issue. And all the topics around diabetes and management of diabetes are addressed in there, including we do an annual recipe book and an annual informational book, which we send out and we give out. Also, we do talks at anywhere where we are invited. We have a schools program called Denim for Diabetes. It's in your genes, where we go and educate school children and teachers about diabetes and why it's important to eat healthy and exercise. We also have a membership. Yeah, we have a membership which gives out free machines, free booklets, information, and we keep you up to date and travel the journey with you to help you manage your diabetes and avoid the terrible complications that can develop from unmanaged.
Thank you, Margot. I'm particularly excited to hear about the wonderful work you do when it comes to youth, the camps, and also your wellness, your community wellness groups. And, education does start with the younger and in families, and the same with the Heart and Stroke Foundation and the Cancer Association. Focusing on children, on youth, and starting with that message early is so important, and getting them involved is one way of educating, lowering that risk, and helping to manage the disease much more effectively. Thank you so much for sharing, and let's continue for another 56 years of making an impact. As we close this important conversation, it's clear that leadership is the defining ingredient in the fight against non-communicable diseases. And each year, the Global Week for Action on NCDs shines a spotlight on these challenges. And from 2024 to 2025, the theme is a call we cannot ignore. It's about leadership, time to lead. And that's how us organizations can step up. And as long as we are collaborating with our local governments. We stand at a critical moment. The fourth high-level meeting of the UN General Assembly on NCDs and Mental Health, taking place on 25 September 2025, will be where global leaders must turn their pledges into concrete action. The window for real progress is narrow, but the opportunity is still before us. The organizations represented here today, the Heart and Stroke Foundation South Africa, Diabetes South Africa, and the Cancer Association of South Africa, are not only leading change locally, but are also proud members of the global NCD Alliance, ensuring that Africa and South Africa's voice is heard in the global movement. Let's commit to championing stronger leadership, deeper collaboration, and urgent action, because together we can turn the tide on NCDs and build a healthier future for all.